So here, why don't we just dive straight in here? Look, no niceties at all, Dr. Hina. Just jump straight in.
Okay.
What does it look like when AI gets mental health wrong? And can you give us any real world examples?
When AI gets mental health wrong, I think the most interesting and equally dangerous part about that is it's never too obvious, never too absurd. It's warm, confident, fluent. Wrong kind of certainty, wrong kind of time. So, and that's the most dangerous part about it. They don't even realize it's getting it all wrong. Take an example of a very classic textbook florid manic case when somebody comes to us with tons of energy, lots of plans, incredible plans to take over the world, would just go to the LLM, says that I've got lots of energy, I've got these plans, I want to remortgage my house, and I've got these 3 fantastic business ideas to invest my money into. Chances are, and I've seen that myself, putting those sort of prompts into the LLMs, and the LLM comes back as, wow, that's fantastic, let's map it out. A very good LLM would actually give the whole roadmap of 3 month, 6 month, 9 month plan for it. Whereas that same person, if he would come to us as in a psychiatric clinic, we would be exploring more about his capacity to manage finances, and we would do our best to safeguard his finances while treating him at the same time.
When we look at the design of these tools, they are, at worst, a sycophant. In other words, yes, you're amazing. By the way, folks, please do that at 8 o'clock every morning, starting your day. But equally, that confident tone you're describing there can be dangerous. How accountable do we hold the designers for producing answers? Because can we, Dr. Hina, expect them to understand or have the skill that a psychiatrist would? So when you hear them talking about that, redesign my life, have 3 this, 3 that, how can I know that they are actually struggling? What is it that triggers in your head as a professional, and therefore should trigger in the model, that there's more than the surface comments that need considered?
As any doctor would learn from the medical school's time, you start assessing a patient as soon as they enter the door. You see the gait, you see the fidgetiness, you see the restlessness, you see the words, the mood, what they're saying, and what the effect on the face. Is that congruent? So you see a lot of background reading. You just don't take everything on the face value of what person is saying. We actually see what's in the background as well. But also, especially in mental health, it's not just a one-off appointment anyway. We need years of history taking. We need to go back to pretty much from the childhood, from the birth, sometimes even before birth, to understand a patient's life journey. We need collateral history from the family members. We need the ongoing stresses. We can see at that very moment if a patient is intoxicated under the influence of drugs or alcohol. Whereas in AI, it would just be reading like a script. It just has words. What person would be feeding that into the LLM? So that's the difference. And therefore, no matter how sophisticated the AI tool is, a medical device AI tool is, you would always need a human layer to it, the human in the loop, as I think these AI governance words are. I think you need that, because otherwise the accountability would be at huge danger, at who's responsible.